academic,
Yeah.
emotional, and interpersonal impact of ADHD. And I want us to look at this not just from managing ADHD in a classroom from that perspective, but look at it as what happens if ADHD is not identified and worked on in the long term. Because this is a disorder which affects children, we often only are concerned about it till they finish school. Once they finish school and step into the world as adults, into the workspace, then we somehow forget that, maybe ADHD is a thing, and that it does, the impact that it has on them with their colleagues in their workplace and in, life in general. We seem to sort of neglect the impact. So today I want to, stress upon the fact that ADHD is not something that stays with a child only for as long as he or she is in school and then disappear, but it's something that's going to stay with them lifelong. And so we are looking at multiple impacts of this disorder. We'll start off with what is ADHD. I'm sure, excuse me. I'm sure many of us here already know ADHD. Either we've worked with children like that, or we teach children, and we suspect that in a classroom maybe we have one or two children, or we have, children of our own who have ADHD. Then, what is the procedure for diagnosing someone with ADHD? What happens to ADHD in childhood and adulthood? Is adult ADHD a thing? What are the neurobiological impacts or aspects of ADHD that we need to cover? And then the impact of ADHD on academics, on cognition, on social and interpersonal relations, including emotional issues. And finally, looking at some strategies to manage ADHD. Um, so if we look at, the diagnosis of ADHD, there are of course multiple diagnostic guidelines. The two most popular that are used across the world are the DSM. Right now, we have the fifth version. The DSM stands for Diagnostic and Statistical Manual, which is used by the American Psychological Association, and therefore, people who follow that classification use the DSM 5. We also have the International Classification of Disorders, or ICD. I think version 11 is out. The ICD is more from the WHO perspective, and UK and a lot of other countries that follow that module use the ICD for convenience, and they're more or less the same kind of diagnostic criteria, just the way they word it and what are included under that, there might be slight variations. So for today's purposes, I'm just looking at the DSM-5 because it's simpler to work with and understand. Under the DSM-5, ADHD is definitely marked as a neurobehavioral disorder, and it has three key symptoms or clusters of symptoms which come under inattention, hyperactivity, and hyperactivity and restlessness. And the third component is impulsivity, right? So, inattention, hyperactivity slash restlessness, and impulsivity. All these three aspects have to be present in an individual. They must be persistent. They must cause significant disruption to daily life. Only then we will diagnose the individual as having ADHD. What this means is that just because somebody is having difficulty sustaining their attention maybe over 1 or 2 days, or maybe even a month or so, we don't diagnose them straight away as having ADHD. It must be a long-standing problem. A minimum of 6 months is what DSM-5 requires, and then this must cause disruption in their lives. Again, another thing is we need to also consider, with adults it probably becomes easier for us to estimate attention, but with children the level of inattention may also be related to their age. often we miss out on diagnosing children with ADHD because maybe parents, maybe extended family members seem to think that, oh, he's just a child, he will outgrow it, or she will, get better as she grows up. And so they ignore it and they don't want a label pinned on it because they think it's being part of a child. At this point, I'd like to also stress upon the fact that with proper diagnostic tools or methods, we will be able to diagnose someone as having ADHD by the age of 3. As young as 3 years of age, ADHD can be diagnosed. Unlike, say, something like a learning disorder where we have to wait till about 6 or 7, ADHD can be identified earlier on, and therefore it becomes important for us to be able to understand this aspect of ADHD, right? So, when do we say a person has ADHD? They need to have at least 6 symptoms of either inattention or hyperactivity, restlessness, or impulsivity. And I'll talk to you about what those are, not just inattention, but at least 6. They must be present for 6 months or more. They must be present before the age of 12. I'd like to sort of also highlight here that this particular aspect refers to only childhood ADHD. When it comes to adult ADHD, I will talk to you about how the diagnosis slightly changes there. So, symptoms must be present before the age of 12 if we were to say that this person has been having ADHD since childhood. And then it must be present in at least 2 situations, which means that maybe it's present at home and then in school, or maybe it's present at workplace and with friends, but it's not seen in the other 2 places, right? So there can be places where the ADHD is seen more frequently, and there are places where ADHD is not seen at all. Why is this important? Because often we have parents who come to us and who are very, very angry and upset, stating that the school has said that there is a problem with my child. I don't see it as a problem, so I think the school is targeting my child. So it becomes important for us to understand that this is a normal or a uniformal or a universal phenomena where symptoms are not seen across all situations. So if a parent says that the child behaves in this way, which is quite contrasting to what the school is reporting, it does not mean that the school is targeting the child. It also does not mean that the parent is lying and protecting the child. It just means that the ADHD may not show up in those environments. Of course, the converse can be true, that we currently we are about to start work with a child where the ADHD is more apparent at home and maybe occasionally in school, but it does not show up in any of the remedial centers that she visits. And that then looks like the parents are hyping it up because the mother always reports that she's troubled by the child's symptoms, but then when she goes for an assessment, they are not able to see. They may be able to detect it on tests, but they are not able to see the features behaviorally. So it's important for us to understand that ADHD may not be uniform across different settings. So it might be seen more intensely in specific settings. Coming to subtypes of ADHD, like we said, all individuals with ADHD need to have symptoms of inattention, hyperactivity, restlessness, and impulsivity. However, they can be predominantly inattentive type, which means they definitely have inattention, but they may have less of the hyperactivity and the restless type. On the other hand, they can be the hyperactive, restless, it should read as impulsive and restless type. They can have predominantly more the impulsive and hyperactive symptoms. They do have inattentive symptoms, but not as many as the hyperactive and restless type. Mixed means they have prevalence of both symptoms. So for each of these, the inattentive type, they must have at least 6 of inattention. For hyperactive and impulsive type, they must have 6 of at least 6 symptoms of impulsivity slash hyperactivity. For the mixed, they must have at least 6 of both combined, right? So what are some of these inattentive types? Inattention can be diagnosed on the basis of inability to sustain attention over a period of time. What does that mean? That, the child's sitting tolerance is low. The child cannot sit in a place for long, is constantly getting up and wandering, is not able to complete a task, or while sitting to do one task, is referring to multiple other things, or is jumping from one activity to another. We often see it as inability to pay attention to the minute details, right? Looks at the larger picture and reacts to it. Many a times we have children who, when we start assessing them, they tell us, even before we complete the instructions, they tell us, yeah, we understood, please carry on. Give me present the items. You don't have to tell me what the rules are. I know it already. Okay. Inattention can also, for example, present as an inability to be patient till the end of a conversation. They get very distracted, and therefore long drawn conversations, they appear to be switched off. They are also very forgetful, and they appear to lose things often. Important things, daily, simple things, like maybe their pencil, maybe their books. So if they tell you, I put my pencil box out while I was setting my bag, and I forgot to put it inside my bag, and therefore I've come to school today without a pencil, we can believe that that's true, because they often tend to be distracted. These are the children who are constantly going to the lost property section to look for their things, because they leave behind their jackets, they leave behind their pencil cases, they lose. And parents often report to us that we have to keep stock of stationery, because they run through one box of pencils or erasers very, very quickly. Large, not because they're using it so much, but because they forget and they lose it, right? They also have trouble organizing tasks. What should I do first? What should I do next? Prioritizing. Again, there's a discrepancy here. Parents will tell us if they're interested in something, they're very capable of organizing themselves. Like if they have to go to school, then they seem to have trouble getting up on time. But if they have a football match to play, or a tournament that day with their friends, then on that day they seem to wake up ahead of schedule, and they're all set to go, right? So they have trouble organizing tasks, particularly the routine and mundane tasks. And another thing that often people report is that they have trouble following instructions. um, Either they forget and then they do the exact opposite of what they're told, or they do exactly what they're told not to do, or they don't wait till the instructions are given. They're in a hurry, and therefore they don't follow through instructions. It appears that maybe they have problem with comprehension, but more likely it is because of inattention. The hyperactive, restless, impulsive type. Under DSM-5, the hyperactive slash restless slash impulsive type, all of them come under one category. Earlier, there used to be another two categories, which used to be referred to as ADD and ADHD, which means that you had people who had predominantly inattentive symptoms, but they did not present with any restlessness or hyperactivity or impulsivity, and therefore they were called ADD. And then you had one which had both impulsivity, hyperactivity, and also inattention, and they were called the ADHD. This was in DSM-4 and DSM-3 3R. But subsequently, since I think 2014, they have changed this to say that there is no ADD, right? You only have ADHD inattentive type, or you can have ADHD impulsive slash hyperactive type, or you can have the combined type. So the inattention, or the hyperactive and restlessness could present as being fidgety, squirmy. These are the children whose legs are constantly on the move. They're tapping on something, they're chewing on a pencil, they're hitting the pencil to the table, they're drumming on the table. You can hear them wherever they are, because they're squirming or fidgeting. We many a times have to be careful about the kind of chair we give the child, because if you give them a plastic chair which is easy to rock, they'll constantly keep rocking. And we've had several instances where the chair slips, the child falls down, and thankfully has not gotten hurt, but still, the risk of them being accident prone are very, very high because they can't sit still and they're constantly rocking. Give them a swirl or a swivel chair, and then you can never get them to sit still. They're constantly rotating. So I noticed in the short video of Brindavan that was being aired, there was the online intervention or remedial sessions that you mentioned. I'm sure those of you who take the online sessions would have noticed with children with ADHD that either they're constantly opening multiple screens and they don't pay attention to what you're saying, or they're turning around in their chair. We've often had children who may be sitting on their sofas at home, and they would be sitting ulta with their legs up in the air and heads down. And then we have to talk to them and have the session with them hanging upside down on their chair. So constantly fidgeting, trouble sitting still, running around, jumping up and down, climbing. And like I said, they cannot play quietly. The moment we hear a child come into our session, right from the time they open the main door, we know the diagnosis is set that it has to be ADHD, more of the impulsive and restless hyperactive type. They talk excessively. This is a common complaint, and they often interrupt conversations because they have trouble waiting for their turn. This is the child who typically would blurt out answers even when you say, raise your hand, I will call out your name, only then you will give me the answer. These are the ones that would blurt out their answers because they're not able to control their impulses. These are also the children who would be very happy to be your class monitors. So they do a lot of what we call as policing, and they cannot ignore somebody else's behavior. If ever you find that a child is in the middle of an aggressive, fight, more likely than not, this is a child with ADHD. They will pick up the cause of somebody else and fight for or on behalf of that child. They have nothing to do with the situation, but they will butt their noses in and they will fight and they will insist that everybody follows the rules because they are not able to ignore somebody else breaking a rule. They will say the right thing, which is what sometimes gets parents all riled up, because they feel that, well, what's wrong in what my child is saying? You're supposed to follow the rule, and if you don't follow the rule, you should be the one to blame, not my child, right? But the problem is that I'm not saying that we should ignore it when people blatantly break rules, but sometimes it's okay for somebody to break a rule, and it's okay for you to not remind them and say that, you've done this. Maybe there's a teacher in class, or maybe there's someone else who's responsible for doing that, but a child with ADHD will be unable to stop himself or herself and will have to correct others. And we've often had people who get into fights with these children because the child insists on correcting them and say, oh, you said this wrong, or that was not pronounced properly, or this is how you should say it, even when a parent or a teacher is reprimanding them for something that the child has done wrong. They're constantly correcting, a diction or maybe a rule or something, because they have huge amounts of trouble ignoring others' behaviors. They also appear to have a lot of energy. These are the children who are always leaving their seats. Teachers often, earlier on used to say that as long as I'm maintaining eye contact with the children in class, he or she is sitting in their place. But the moment my back is turned to put up something on the board, this child is out of the place or gets into a fight or drops an eraser, and then, in a hurry to get the eraser, drags the chair on the floor and makes a loud noise. So they seem to be constantly sort of wanting to be heard. And often teachers would also tell us that either very young children run out of the classroom, or slightly older children will ask for frequent washroom breaks because they are not able to sit still for long. They have to walk out of the corridors, and many of them like to spend time outside the class than inside. So, and with very young children, parents have also told us that my child has high amounts of energy. He's always on the go. Is not. It's like a motor that goes on and on and on, and I don't have an off switch for this motor. Um, it's also true that in these children sometimes they have less need for sleep, so even if they sleep for about 4 or 5 hours, they still wake up fresh, and when they wake up with a lot of energy. So, having heard the symptoms, now we know that these are the separate kind of symptoms for inattentive type and for the restless, hyperactive, impulsive type. For them to be a mixed type, they must have a little bit of both. For them to be any one of these, they have to have six of either hyperactive or so, which means if I have six of inattentive type and maybe two or three of the hyperactive restless type, then I'm likely to be diagnosed as an inattentive ADHD or ADHD of the inattentive type. If I have six or seven of the hyperactive and impulsive type and maybe three or four of inattentive, I'm predominantly a hyperactive, restless, impulsive type. But if I have, say, about five of inattention, five of hyperactive, restless, inattentive type, sorry, impulsive type, then I'm likely to be mixed, right? So that's how the diagnostic criteria works with adult ADHD. And this is something that was not there earlier on. Maybe prior to DSM 5, we did not have a diagnosis for adult ADHD. We always thought ADHD was limited to childhood and nobody bothered to figure out what happened to adult. But we now know that there is an increasing trend, and in the last couple of years, I myself have been, I have not personally assessed, but in our organization at Samvidh, we have been referred maybe at least 7 or 8 adults who suspect that they have ADHD. And in our assessment, we did identify that they do have ADHD, right? So in childhood or the childhood ADHD, there seems to be more boys than girls with the disorder, 2:1 ratio, which means twice the number of boys are likely to be diagnosed with ADHD as compared to girls. But this kind of a gender bias somehow seems to melt down when it comes to adulthood. And interestingly enough, the number of adults that we have been referred, there's an equal number of both men and women who have come to us saying that we suspect we might have ADHD, right? The difference is with child, maybe we are more likely to experience behavioral issues with them, whereas in adult ADHD, they don't rarely do they come up saying, I think I have ADHD. They do, but then maybe the parents or their spouses or siblings may not believe them and just brush it aside. But they do get diagnosed as having an emotional issue or maybe drug addiction. And then, while screening for that and taking the history, they appear to have secondary, or sorry, they appear to have um, an emotional disorder like, say, anxiety or depression. And then they also seem to have ADHD. So, secondary issues like mood disorders or addiction seem to be very, very common with adult ADHD, much more than with child. So, if you look at the prevalence rates between child and adult, in children, 4 to 7% of children are reported to be diagnosed as ADHD. Of course, this is a there's a huge controversy surrounding this. Um, in the US, there is a higher chance of an individual being diagnosed as ADHD, whereas in the UK, maybe there's a higher chance of someone being diagnosed as being on the spectrum or autism. It could largely have to do with the, like I said, the orientation of either they use DSM more predominantly or they use the ICD more predominantly. That is one. Two is in the US, much of the diagnosis is fueled by the pharmaceutical companies, and they do have a lot of drugs or medication as options for treatment of ADHD, and therefore there's a stronger case made for diagnosis of ADHD, and accommodations and other forms of support systems are more prevalent for ADHD in the US versus for ASD in the UK. That does not mean that they don't diagnose these in like ASD is not diagnosed in the US and ADHD is not diagnosed in UK, but more likely preponderance of ADHD in the US. Um, this could explain why the schools have a higher number of prevalence of diagnosis of ADHD in the US, right? And also mediated by the pharmaceutical companies and the kind of aids that the schools will get if they have or they quote that they have X number of children requiring special needs or assistance, and ADHD is one of them that will definitely land the school some kind of a government funding and therefore the diagnosis. So that can also increase the prevalence rates. In adults, the prevalence rates seems to drop to about 2.5% of the population. Despite that, if you consider all other serious mental health disorders, 2.5% of the population is a huge number. It's not a small number. Just to give you an example, maybe for schizophrenia, it's 1 to 2% of the population, right? Whereas with ADHD, you can already see it's 2.5%. And I'm sure a lot more of them consult for marital issues, consult for maybe the forensic departments. There might be more people with ADHD, and then you also have ADHD who are, because they're accident prone, they're more likely to be in the emergency sections more frequently than people with non-ADHD. And I'm talking about adult. So the reason for consultation may not necessarily be for ADHD, it could be for other things, and that could explain why there is a drop in the prevalence rates. But again, adult ADHD is more a recent phenomena, so we don't have enough data world over for us to say whether this is a genuine drop or that there is, it's just that it's not been identified. Having said that, what happens to those children who are diagnosed as having ADHD? Interestingly, about 60 to 65% of them continue to have ADHD even in adulthood, which means that the ADHD doesn't go away. Your, of course, question might be then what happens to the other 30 or 30, 40 or 35% of them who don't have adult ADHD? Well, they may have remnants of some of the difficulties. The ADHD doesn't simply go away, but it may not be significant enough to cause a huge disruption in their life, unlike this 2.5% of the population that do seek help. They still would have a lot of the other impacts that we're going to be talking about: cognitive, social, interpersonal, emotional, but it may not stand out as being very significant. And many of them do have average intelligence or even above average intelligence, because of which they seem to manage it better than the other people, right? Whereas with when we say adult, so if we say 60 to 65% of individuals who have a diagnosis of ADHD in their childhood and it continues, the remaining number of adults who are diagnosed may not have had very many diagnosable symptoms earlier on. They may have had some challenges, and then when they come into adulthood, the system just breaks. These are the individuals who may also likely present with a lot of other comorbid symptoms, which means that they have ADHD. In addition to that, they have anxiety, depression, and many of them come with very, very significant addiction and criminal behaviors as well. So, overall, if you look at the burden to society and to the medical system, the burden of non diagnosed ADHD is quite significant, because on the one hand, it does, it does affect their academics, but they also have huge problems in their emotional regulation and interpersonal relations. They also seem to be the kind who struggle to manage their time and therefore seem to be underemployed at work or even unemployed. More likely, frequently changing jobs. And if they are unemployed in the West, then they are their sustenance or maintenance has to be taken care of by the government, which then adds an extra cost. In addition, because of their impulsivity, either they're high risk taking or are accident prone, and therefore many of them at least once in their life would have visited the emergency section in a hospital because of their accident proneness. Frequent breaking of bones, falling down, accidents, being involved in, say, high risk lifestyle like racing, bungee jumping, rock climbing, paragliding, these kind of exercises, and having risks and accidents because of that. Because of addiction, they also can present with a lot of cardiovascular symptoms. Many of them eventually also can, what we call as a type A personality, can develop into that, which then leads to a lot of smoking and drinking, and in addition to the interpersonal conflicts, also added health burden to the system. And of course, all of them, regardless of whether they're adult or child, present with cognitive deficits, which can quite significantly impact their overall performance and behavior. So, what do we mean by comorbid conditions? Means they have ADHD. In addition to ADHD, they have something which is also present. So sometimes you can have academic difficulties which are secondary to ADHD. That means that they are not, it's not a learning disorder per se, but they may have they may be having dropping grades or failing in their exams because of their impulsivity or maybe because of their inattention. As a consequence, their academics may be suffering. That becomes a secondary problem. Or they may be, because they are constantly getting into fight with their spouses, they may be going through a marital discord and they may be going through a divorce. And because of that, they may be having secondary depression. But it may not be a primary condition. So you can have a primary diagnosis of ADHD and then something secondary to it. That means it stems out of or as a consequence of the primary diagnosis, which is ADHD. Comorbid conditions, on the other hand, refer to symptoms that are equally present and both are diagnosable, which means that I can have ADHD and I can have learning disorder. So I can have both, or I can have ADHD and I can be on the spectrum. Many children can have ADHD and oppositional defiance disorder, or ADHD uncontrolled, unchecked, has the risk of developing into oppositional defiance disorder, which then also has the risk of being or developing into conduct disorder, or ADHD directly into conduct disorder. So, the conduct disorder and oppositional defiance disorder, more than 80% of them, unchecked ADHD, there's a very, very high chance of them switching into these diagnoses. And at that point in time, both ADHD and conduct, or ADHD and oppositional defiance disorder, seem to stand out. As adults, comorbid conditions, like I've already mentioned, substance abuse, they can have anxiety, they can have depression. Many of them also present with a personality disorder. There's no one particular personality disorder, but most often either narcissistic personality disorder, or you can have an anarchistic personality disorder, or you can also have depressive or anxious avoidant personality disorder. Any of these can be present with adult ADHD. The impact of ADHD can be seen across the board. We can see it in behavior, we can see it in the neurobiology of the individual, which includes the heredity factor, which includes neuroanatomy, and also the cognitive deficits. You can have emotional issues that can be a problem with these children, and you can have interpersonal issues. So these are not mutually exclusive. Just because I have one, it doesn't mean I have the other, and they don't necessarily always have to have all. Like, we have a number of ADHD children or children with ADHD who don't have any interpersonal issues. They can manage their friends beautifully, they're very friendly, They have exceptionally good social skills, but they have, emotional issues, or they may have cognitive difficulties, right? So you need not necessarily have all of these, but these repeatedly seem to be coming up. So you can see what started off as just, inattention and hyperactive and restless now is going into a broader or a wide range of issues which can have leave its mark. The most prominent of all of these issues are, of course, the behavioral issues. And this is the reason why more than 80% of the time, when we see a boy being referred to us for behavioral issues, we automatically, by default, we suspect ADHD and we would want to rule in or rule out ADHD. Having said that, the behavioral issues can present in different ways depending on the age of the individual. For very young children, you can have irritability, crying, shouting, fighting, and throwing tantrums. The slightly, and this I'm talking about 2-year-olds, 3-year-olds, 4-year-olds. From there, then 4, 5, 6, when they're in preschool, they are the more restless, running around, difficult to sit in a place. And these are the children who the parents would say when they are confined in a small space, or they're confined in a space, or when they go to a new place, that's when their hyperactivity is seen very, very significantly. Like in a marriage hall, or when they have to go to a friend's house, or when they're visiting a doctor. These are confined spaces, these are new spaces, these are not spaces that they're used to, and that's where the running around happens a lot more. They have significant amount of trouble following instructions, right? Put your bag here, this is where your jackets have to go, leave your lunch basket on the shelf, let your shoes remove your shoes and place them neatly by the door. All of these instructions, it's not that they don't know, it's not that they've not heard you, but they have trouble remembering it, and therefore they have trouble following instructions. They display a lot of aggression towards children, very, very young children, especially when they've just entered school. Oftentimes, the reports could be biting, scratching other children, tearing their things, taking away their things. All of these can be complaints. They also tend to be very bossy and insist that everybody follows their way, or that they have to set the rules, and whatever rules they set is the one that has to be followed. Nobody else can do anything other than that. If they don't, then they don't want to play. If the friends don't listen to them, they're happy not playing with them, and just sitting by themselves. So this can be in young children. As they move into pre-adolescence and adolescence, the primary concern seems to also now include academics. They are not yet at a stage where it can be diagnosed as a academic difficulty or a disorder, like a learning disorder, but it might just reflect as a gradual drop in grades. They have a lot of trouble fitting in with peers, largely because some of the issues that we reported earlier, that they have to set the rules, everybody has to follow what they say, and if they don't, then all hell breaks loose. Or they might also be having trouble overlooking issues of others, and therefore they have trouble fitting with the peers. Peers often report that these children are very difficult to play with because they're fighting, they're loud, they don't listen to them. And if they're doing something, which most often children are these days, if they're doing something that they're not supposed to be doing, then for sure this child will give them away because they can't keep quiet and they're always loud. And so the group tends to get into trouble more because this child is around. From the child's perspective, they don't listen to me, they tend to do things, they will say this and then do something else, right? So for them to accept this change or a shift in things become very difficult. And therefore, say for example, everybody said, let's all meet at the basketball court and we are all going to play basketball today. And so this child is all set to play basketball, but suddenly the group leader says, oh, I don't feel like playing basketball today, let's all play carom, and so we will meet at so and so's house. Now everybody else seems to be okay with it. They may be a few grumbles, but they might say, oh, it's okay, at least I'm getting to meet my friends and play with them. But this child with ADHD might find it so much of a challenge that then he or she might have a meltdown and say, no, you said basketball, we have to meet at the basketball court, we have to play basketball because you said, right? They're not able to let go of it, and that then becomes a problem. So therefore, many of the peers feel, okay, this person is too difficult for me, and then tends to leave them out. Another thing that some often happens is the children with ADHD like to talk about a few select topics, and they're not over inclusive in their topics. And so they insist on saying the same things again and again. And the friends around them tend to get bored with that and say, well, he's always talking about cars, or he's only talking about dinosaurs. I'm not interested in it. Let's do something else. Right. And therefore, they have great trouble fitting in with peers. They tend to be bossy. We've spoken about this. And they also have a lot of trouble multitasking. So do this, then do that. They have trouble. Or they also have trouble that, okay, now I have an Hindi assignment to submit, and I have math tuitions to attend, and I have Kannada homework to do. Then it becomes overwhelming for them because they have to keep switching gears, and then they have to keep up with the schedule. Right now, or I was seeing a girl who's in ninth grade. Her session with me was on, 3 specific days, between 4 and 5 in the evening. And till date, I probably would have had about 20 sessions with her. I've never seen her even once exactly at 4 o'clock. Always 15 minutes late, 20 minutes late. And when she comes for the session, 5 minutes into the session, she'll say, can I please go to the washroom? May I drink some water? I'm sorry, I have my alarm set for my class, which is half an hour later. Can I just turn that off and come? Constantly asking for breaks and having great amount of trouble being organized and sitting in for our session. They have a lot of trouble prioritizing, and that then leads to these kind of scheduling issues with them. As they go into adults, the academic issues may or may not persist. Somehow they may manage, to finish their engineering, finish their MBA, whatever it is, but they have trouble in identifying their own mistakes. So, what we often call as insight, right? No, I didn't do this. You said it. You were at fault, is often the kind of approach that they have, because of which they seem to have a lot of trouble with their colleagues and their superiors. Remember, we spoke of unemployment and frequently quitting jobs. This is one of the strongest reasons, because they're not very good team players, and as a consequence, the other members in the team are sort of upset about them not being able to meet deadlines, not being able to stick to a schedule, and this then causes the team to suffer, and therefore, they get into a lot of trouble with the team members. They have trouble accepting and identifying another person's perspective, right? For them, two people can be right is often a very, very, very difficult aspect. I'm having two friends now who I see individually, but the strangest request came from them a month ago, and they both wanted to be seen together because they were having a lot of trouble with each other. And then I said, okay, how do you, what are some of the issues? So one guy says, I love Formula One racing. So every time we hang out, I want my friend, to also play Formula One racing with me. And it's an online game. Two players, they both pull out their laptops and they play on it. The other guy says, well, I tried. I don't like Formula One racing. I'd much rather be, going out and riding on my bike. And this guy always wants to be sitting in and playing with his laptop, and we're only doing F1 racing. I don't like it, right? So both of them have a huge amount of trouble accepting that other people can have different likes, and it's okay. If we want to hang out together, we must do something that both of us like, rather than forcing what one person wants, right? Because of this, because they have trouble looking at another person's perspective, they also have trouble in keeping up with conversations, forgetting. We've mentioned it before, even in adulthood the forgetting becomes that much more. You can imagine, say there's a young mother with a child, and she tells her husband, I've run out of diapers, can you please bring diapers on your way back from home, on your way back home from work. The husband comes in at 9 o'clock, without the diapers, and there are absolutely no diapers at home. So you can imagine what that would do to the marital relationship of these two individuals. So frequent forgetting, and then combined with not being able to admit to their mistake, anger, and that leading to fights and quarrels. It can also then lead to significant mood difficulties. Addiction is something that a lot of them struggle with. Earlier, it used to be smoking, alcohol, drugs. It still is, but now there's one more thing which is added to it, which is screens. And since screen addiction has taken on, or technology addiction, or smartphone addiction, however we want to label it, although they're all technically not the same, but we often seem to use them interchangeably. But addiction seems to be a thing. I've Right now, I think my plate is full with about five adult ADHDs. All five of them are men, boys, males, and all of them have addictions of various kinds. Um, there's one boy who he says, I know I have to study. He's doing his MD, and he's finished his MBBS, and he's specializing in something now. He's in the last 6 months of his course. He now has to keep up with his studying. He has to put in at least 6 or 7 hours of studying a day, and he can barely do 2 hours, because when he sits down to study, he's studying on his tab, and then he loses track of what he's doing, and he opens multiple windows, and then the studying goes for a toss. The other person that I'm seeing, he says, I have to write a letter. I just have to write this letter and post it, and then give my applications. He's applying for his MBA program in the US. He has to write either a GRE or a GMAT. And for the past 4 months, we've been talking about it. He cannot make up his mind whether he wants to do GRE or GMAT. He's spoken to about 8 professors from the university that he wants to apply in the department that he wants to apply to. They have all said choose XYZ, but he still has not made up his mind. So procrastination is something that's very, very real with ADHD, regardless of whether it's adult or child. And more so with the adult, procrastination becomes a thing. And if you look into what is causing procrastination, that then is addiction. And all of these, the five boys that I was talking to you about, all of them, the bottom line of their procrastination comes from the smartphone addiction, right? So you can imagine that this already causes a lot of problems. In addition to that, there are some very, very specific emotional issues that only ADHDs can come up with, and that can cause a lot of problems. One is very easily bored. You can see, regardless of whether it's a child or an adult, the first thing that the child will say is, I'm bored, give me something to do. Because you're so tired trying to keep these people entertained or keep them occupied, you tend to just, give them something. And maybe earlier it used to be television. Now it seems to be smartphones or tabs. Sorry. You give it to them, and then keep them occupied, because otherwise it becomes very, very difficult to keep them engaged. Give them something, they can't sustain their attention for longer than 10-15 minutes. They're easily bored, and because of that, they give up. This happens a lot with the hobbies. So you teach them, they say, we want to do football, we want to learn how to play the guitar. Okay, investing in a guitar is expensive, and then the lessons don't come cheap. And then you have to drive them to wherever the classes are. And so there's a lot of time, money that you are investing on your part, but you're happy to do that because your child might be talented. You never know, right? They do it with all honesty, and more often than not, the instructors will tell you your child is very, very capable and picks up very fast. So they're quick learners. They can pick up very fast, but as quickly as they pick up, they also tend to give up, and they get bored with it. 3 months down the lane, when everybody else is warming up and picking up and moving on to the more difficult lessons, our child does not want to practice anymore because he's just singing the same happy birthday song. I don't want to do it anymore. Can I go on to something else? Now, maybe within guitar, I don't want an electric guitar. I want to move on to an acoustic guitar, and from lead, I want to go to bass. Or it could be from guitar, now I want gymnastics. I don't want guitar at all. And then you're doing the same thing all over again. 3 months into gymnastics, I'm bored with gymnastics. Let's do skating or let's do taekwondo, right? So they just keep jumping from one to another and they don't complete the task, largely because they're bored, but also because they get into trouble with their instructor. Instructor will say, practice and perfect this lesson and then come back and then we move to the next one. That's when it becomes a fight because they never practice and then they don't want to admit, and when the teacher points it out, it becomes an anger issue. The moment the teacher is strict with them, then they get angry and say, I won't go into this class again. Then they're not consistent in pursuing their goals, and they only work when they have deadlines. So for this guy that I was talking to you about applying for an MBA program, the university has said, if you want admission in the coming year, by 5th of January, you have to submit your application form and pick a date for your entrance exam. Either not entrance exam, your GRE or your GMAT. You have to decide which of the two you want to do. The application processes for both are different and they cost a lot of money. For those of you who know, if you've been involved in the admission process for these or enrollment process for these, and then the approach to and the studying and the prep work for all of that is very different. We are already on the 20th of December today. He still has not decided whether he's going to take GRE or GMAT, and he still has not filled in his application form and submitted it. So there's no way he's going to be able to take the exam this year. So one of his counselors has said, why don't you take it next year? So he immediately then tends to jump to that and say, oh, if I want to, I have 9 months time. Next September, it'll open up and I can take the exam. Sure, sounds logical. But if you work only well under deadlines, then your deadline is not going to come for the next 9 months. What are you going to do for those 8 months in between? For sure, he's going to be on his phone, tab, and do nothing. It'll be a year back that he takes or a drop year. And then there's no guarantee that even next September, he's going to be able to do the work and submit his papers on time, right? So most of them, the ones who are in school, tend to get by because the parents would push them and say submissions are happening, today's the last date. If last date is over, then they would go on their behalf and talk to the teacher and say, please let my child submit. Late submission, deduct some marks, but you please accept the submission. And then they sit all night with the child and make sure that the assignment is done, and then the submission happens. So they appear to work best under deadlines because we are pushing, we are propelling it. You leave it to them. Some of them, milder forms of ADHD, will sit through all night and finish it. And those are the ones who would tell you, I study best only one day before my exam. Not true. Nobody can study best under that kind of pressure, but that's the only time my ADHD will study. They will not study otherwise. They're very, very, very sensitive to criticism. The moment somebody points out a flaw in them, immediately they sulk, they become irritable. It can turn into huge fights. So the anger outbursts, the meltdowns happen when they're sensitive to criticism. Just to give you an example of what sensitivity to criticism can mean, all of us work with children who have maybe writing issues. And when they write an essay, as part of our job, we would have to look at the essay and give them feedback in terms of how, they can improve their writing style. It could be the content, it could be spelling, it could be the grammar, or it could just be, different ideas that they have left out or pertinent points that they could have included that they've overlooked. We often tend to do it by writing or on the essay of the child, by scribbling in our notes. either in a pencil or in a different colored ink so that it stands out. And the aim is not to use that as a form of criticism, but as a form of feedback so that the child learns. And then if you use a different color, it pops up, and we want the child to remember it and incorporate this feedback next time round when he or she is writing an essay. For a child who's super sensitive to criticism, we've had several of these children. They would first of all insist that you don't write anything on their book, and even if you do, it should not be in ink. It could be in pencil so that that can be erased. And they don't want you to use red ink. I don't know how many of you have had these experiences, but maybe when we have a discussion, you can share your experiences with us. But these are the kids who have ADHD, who would like feedback, but the feedback may not be very effective because they may not show significant progress after that. And we'll talk about why that issue happens. And then they may also have trouble taking the criticism, or it's not criticism really, it's feedback, but they perceive it as criticism. And then they have a meltdown and they say, you can't do this to me. We have a child who he's no longer a child, of course, he's about 25 now. But when he used to come to us, he would say, I come from an alternate school and we've been told we can write however we want. Don't use red ink to write on my essay, and I don't like it. I think you're being very strict with me. And he would fight with us and then walk out of the session, storm out of the session. And then he would come back in the next session and apologize and say, okay, this was after his parents point out to him why we've done what we've done. And then he realizes and he comes back and he apologizes, right? And this would happen almost every once in 2 weeks. So frequent meltdowns, frequent mood changes, extra sensitivity to criticism. The cognitive neurobiological aspects. This is something, of course, this is what is my favorite part of the whole thing because that's what I specialize in. On the one hand, there is a genetic load, right? There is a huge, like, if there is someone in the family already diagnosed as having ADHD, then the risk for other people is quite clear. It's quite evident. You For monozygotic twins, which means identical twins, there's a 70% risk. If you're an offspring of a parent who has ADHD, then your risk is 50%. For a sibling or a non-identical twin, it is 5%. And for cousins, it's 2.2%. These sound like small numbers, but they're not really. It is quite a significant risk that you carry when you have someone in the family diagnosed as having ADHD. The chances of you also having ADHD are quite high. Um, there could be other reasons for without any of the heredity risk. When the mother is exposed to a lot of certain kinds of lead, to alcohol, to some forms of medication, and also to, I'm sorry, uh, to a lot of stress during pregnancy. Just give me a minute, please. Right, thank you. Uh, Also, when children have low birth weight, and additionally, children of alcoholics are at great risk for developing ADHD. In addition, the neurobiology of it, even if we account for all of this, there's no stress, the mother does not consume alcohol, there are no relatives with ADHD. Despite that, if there is ADHD, then why do we call it a neurobiological or a neurodevelopmental aspect? Is because there are specific networks in the brain that have been identified as having or being implicated in ADHD. Three specific networks. We spoke, I don't know how many of you were there when we spoke of the executive function networks. These networks we covered there, but I'm going to be talking about it again today as well. So it'll be like a refreshing sequence. So these three networks, the default mode, the salience network, and also the executive network are implicated. Less of the executive network, but more of the default and the salience network implicated in ADHD. You have two other networks, the dorsal and the ventral attention network, all of which are implicated in ADHD. And I'll talk to you about what I mean by implicated, right? You have specific regions in the brain which are responsible for, like I've said, allocation of attention, of detecting a salience, and attentional shifting. I'll explain what that means, right? For example, now as I was talking to you in my previous slide, I got a notification saying your battery is low. Okay, so till that notification came, I'm supposed to be paying attention to what is there on the slide and to organize my thoughts in a manner that will help me to deliver my talk to you. And you are supposed to be paying attention to me and following the order in which I'm saying all of these things and connecting it to the slides and the text that's there on the slides, right? So that is allocation of attention. I would be able to do all of this only if the resources in my brain allow me to do all of this and do it smoothly. That is carried out by the left superior temporal lobes. And I'll show it to you in the brain in my next slide. From there, then, suddenly, I'm sorry, my bad. Suddenly, I got a notification saying battery is low. So that I had to identify is an important thing. It could have been a notification, maybe, I have a meeting later on in the day, or my alarm set on my phone and that's ringing here, or it could be something else that I have set as a, or maybe I had an appointment which I do have on Saturdays, and it's a notification for that. So there is a change that is coming in which is demanding my attention, but my supramarginal gyrus will detect the importance of that change and then facilitate my attention to switch from that to this, right? Okay, I was talking, but now there's low battery. If I don't attend to it, then my laptop will shut down and my lecture will get disrupted. So I have to immediately pay attention to that, right? So for me to detect the change or the stimulus in the environment, my supramarginal gyrus needs to be active. And then the right angular gyrus will help shift attention from there to the and to come back, right? So I knew the battery was low. I connected my laptop, and then I quickly was able to tell you, just give me a minute, I need to attend to this, and then go back to my lecture and continue talking. So this switch from this to that and back to this again is controlled by the right angular gyrus. All of this, it's smooth, and if I have not explained it to you, you probably would have said, oh, she's forgetful, she just forgot to charge her laptop, or she forgot to check about her battery, whatever, and then we'll continue. You will make a judgment of me, whatever, or you won't, and you'll say, oh, poor thing, she must have been busy, she's forgotten, whatever, and then we move on to whatever I'm saying, and that's just water under the bridge. But what really happens is it's like an orchestra in the brain. These networks have to then talk to each other. The firing happens. The left superior temporal lobe has been firing all this while. Suddenly, the supramarginal gyrus will say, hang on, boss, you need to pay attention to this. This is important. And once you've attended to it, the angular gyrus will say, I finished attending. Now go back to that. And my attention switches from this to that. And all of this is happening in split seconds without us realizing it. And that is possible because of this beautiful network that happens and crosstalk that happens between the dorsal, the ventral attention networks, the default mode, and the salience mode, right? So if we look at um, the DAN or the dorsal attention system and the VAN or the ventral attention system. These are two very important attention systems. The dorsal attention system predominantly on the left hemisphere, you can see this in the blue, and then the ventral attention system predominantly on the right. You can see this in orange, and then you also have some of the visual aspects of it, which is in the pale blue here, right? So it's largely the frontal eye field and then the intraparietal sulcus, which does the allocation of attention to ongoing activity. So for this entire 2 hours, my attention is towards you and your attention is towards me. That is possible only because of this crosstalk between, and it has to be a huge bundle of fibers, right? Between the frontal eye field and the intraparietal sulcus. And of course, I'm talking, I'm reading, I'm making jokes, I'm moving my hands. So it involves a lot of other coordinated regions in the brain that will have to talk to each other. Now, the moment something impinges on our attention, maybe my dog barks or the power goes out, or it's very cold in the room, I need water, any of that, then the temporoparietal junction and the ventromedial prefrontal cortex, this in the orange, these two will talk to each other. And then you can see there's a reciprocal relationship between the frontal eye field and the intraparietal sulcus. You can see there are weak signals here on the left hemisphere, but a strong signal on the right hemisphere, right? So there is a crosstalk happening, and imagine from the left hemisphere you have to receive signals onto the right and vice versa for all of this to happen smoothly. In ADHD, once they start an activity, maybe constant impinging happens from the ventral system onto the dorsal system, which is why they keep getting distracted, and that's your inattentive type. Or if they are the impulsive type, then they are not able to complete an activity, so the dorsal attention becomes a problem. If they're also the hyperactive and the restless type, then there is a constant they get signals, but the signals get mixed up and they're not able to really streamline this and follow through on what is happening, right? Many a times we also find, which is another problem which I'll talk about, is it's they can to start an activity they have a lot of trouble, but once they start, then they're at it for a while. Then the next problem comes when they have to stop that activity, predominantly when it comes to watching TV. Maybe they're sitting and eating, and they take 3 hours to eat, and you're fed up and you say, okay, lunch is over, please leave the table, and go, and I'll clean up after you. Just go. From the lunch table they go straight down, switch on the TV, and then they're watching. 2 hours are up, 3 hours are up, they don't stop. And then you tell them, now lunch is sorry, TV time is over, it's time for you to study. And then the meltdown happens, and we assume the meltdown happens because they don't want to give up what they're watching. But often they may not even be processing what they're watching. Their minds are wandering. But for them to switch out of TV mode into study mode, it comes at a cost. It becomes very difficult for them. So this shifting of attention comes at a cost. And that is why they find it difficult to let go. So along with the DAN and the VAN, which is the ventral attention system and the dorsal attention system, you also have three systems in the brain, which are controlled by, again, large bundles. You have the central executive network, which is primarily on both hemispheres, but largely on the left, your dorsolateral prefrontal cortex and the posterior parietal cortex, where the attention is allotted to an ongoing activity. Maybe you have to study, maybe you have a dance recital, maybe you're applying makeup, maybe you're covering or binding the books for next academic year, whatever the activity you're doing. um, the central executive network will be the one in charge to tell you how much time is required, will be in charge to tell you, what you should be doing with your left hand, with your right hand. Do you need scissors? Do you need paper? Should you be sitting in this room? Should you sit at the table or on the floor? All of that, the executive network will take care of. Then, so that is what we call as a task active network. Then you also have a default mode network, which you can see in the medial prefrontal cortex, right in the middle, right in the frontal lobe, and the anterior, sorry, the posterior corpus callosum. The cingulate cortex, the posterior cingulate cortex, my bad. So the medial prefrontal cortex and the posterior cingulate cortex is where the default mode is. The default mode is when you have nothing to do. You're sitting quietly, maybe you're meditating, maybe you're just resting, maybe you're just swiping, and watching reels on YouTube, whatever it is that you're doing. You're just sitting in class waiting for the next teacher to walk in. That's when the default mode is active. Your mind is wandering, you're dreaming, you're sleepy, you're thinking of what can I do tomorrow? I have a party to go to, my secret Santa, I have to wrap my gift. Whatever it is that you're thinking of, it's the default mode. And that's the autobiographical memory, right? That, okay, this is what I have to do, or this is where I am. I'm sitting on a chair, it's rather uncomfortable for me. Can I shift my position? All of that is being done by the default mode. Now, this is what we call as a task negative mode or a resting state. The moment I start doing an activity which is more focused, which is more relevant, or not just relevant, but something that involves some doing, we automatically switch into a central executive. So the default mode and the central executive are actually mutually exclusive. When one is active, the other has to be silenced, right? But in ADHD, you can see, like this boy that I was talking about, who finished his MBBS and is doing his MD, he's studying, which means the central executive network gets stimulated and is on for 15 minutes. And then suddenly it switches into default mode and his mind is wandering and he's wondering about, oh, okay, when will I get married? My girlfriend's father has called me for a meeting, and he switches into that mode without realizing it, right? And then he's looking at the screen, he's reading the text, but his mind is not on it because he's busy thinking about his would-be father-in-law that he has to meet. So the uh, switching happens almost automatically and is not in his control, and his study session goes for a toss. So there is a leaking of the default mode into the central executive, and it completely takes over. So uh, this switch, when we do it willfully, is controlled by the salience network, which is the anterior cingulate and the insula. Um, Sorry, not, yeah, the anterior cingulate cortex and the insula act as a switch to help action mode or activity mode to mind wandering mode, and more in terms of, just doing nothing. So the task positive network switches into a task negative network using the insula and the anterior cingulate. The anterior cingulate decides on whether I should be switching or I should not. The insula is what builds the insight, is what tells you this is the right thing to do, is what tells you this is the importance of this activity, and therefore this is what you must do, right? And on the basis of that, you decide whether your mind should be wandering or, oh my God, I've lost time. My mind has wandered for 20 minutes. Let me get back and finish this chapter. That switch happens because of the insula and the decision by the anterior cingulate. And from default mode, we quickly come into the executive. Or we will say, okay, I notice that every time I'm sitting on my laptop, I tend to switch off and go into multiple screens. Therefore, I'm going to, instead of studying from my laptop, pull out my textbook and study from there. Or I'm going to hold my textbook and walk up and down and read so that I don't switch or watch multiple screens. So that decision again is taken by the central executive, and the salience network helps and assists in this decision making, whereas the default mode then is silenced because it's not time for us to be inactive, it's time for us to be active now, right? With ADHD, when they're expected to sit quietly and wait for the next teacher to come, they're jumping up and down and they're talking. And when they're expected to talk, that's when their mind is wandering and they're not paying attention to the class, right? Um, you must be surprised, those of you who know me well, why haven't I come up with stories? Well, here are the stories. I thought interpersonal, emotional, and social issues are best explained, giving you two stories, two people that I have seen. One, of course, is this. He was 9 years old when I saw him. Now, of course, he must be around 13. he loved playing with his friends, and he was a very, very friendly child. He was the only child, so he loved being outside and playing with his friends. But every time the parents sent him down to play, he would come back crying or angry and say, my friends don't listen to me. And then, because of this, he got into a fight with them, and now he doesn't want to go down at all. He argues, and his friends always complain that he insists on them doing everything the way he wants. He never listens to them, and so they don't want to play with him. This frequent thing would happen at home. Initially, it did not happen in school, and he was considered to be a very bright child in school. However, eventually, over a period of time, this started happening in school to a point where he would, uh, because he was upset with somebody who did not play with him yesterday, today he would come into school. He would take their water bottle out of their lunchbox and then throw it into the washroom. And he would try to flush it down the toilet. So he's been caught on several occasions doing things like this. He once locked up a teacher and a child in a classroom because they were both mean to him. So he would often get into trouble, not because he could not control himself, but because he was so upset and he failed to see how his actions were wrong, and how they were completely either in excess to the situation, or how that would have a long lasting impact on people around him. And he always wondered why people are upset with him and angry with him. He couldn't see that, right? When his mother tried to point it out, he would get aggressive and he would beat her. And so, the mother was not able to control him. And there were days when he would have a meltdown. During the entire process of a meltdown, maybe half an hour, he would be hitting the mother. She would try to calm him down. And then he would refuse to go to school. Both of them would be exhausted at the end, and there was no point in sending him to school. Or if he does go to school, she would immediately get a call from school saying he's misbehaving, and she would have to come and pick him up. So this was constantly happening, and you can see how various aspects of it could be his default mode, it could be his inflexibility, it could be any of this that was contributing to his social, emotional, and interpersonal issues. An adult that we see on and off, they initially consulted for their daughter who had ADHD. And in the course of the discussion, the father realized that he also has symptoms. He always has had these symptoms. And so he sought help. And, this was the story at that time. Finally, there is now, I think, marital counseling is happening with the couple, because we realized that they were constantly getting into fights. Why would they fight? Because the husband seemed to constantly not take responsibility. He would expect the wife to manage everything at home, not because he was irresponsible, not because he did not want to be involved, but because he would forget. He was constantly fighting against deadlines. If there was a presentation at work, let's say he was told at 11 a.m. today that at 4 p.m. tomorrow he has a presentation, he has enough time to prepare for it. He would postpone it till 7 in the evening. 7 in the evening, daughter says, Appa, I have a project to submit. Can we please go to the stationery shop to buy kg cardboard? And then he would have a huge meltdown because he had a presentation to prepare for the next day, and his daughter was interfering with that, right? This kind of inability to manage things, and always procrastinating till the last minute, was bleeding into his personal life as well. It would He would not pay the bills, so electricity would be cut off in the house. The water bills were mounting up because he would promise his wife that he would pay the bills, and then he would forget, to a point where the wife started taking over paying of the bills on her own. Then investment, he would blow up the money on things, gifts for the family, gifts for his extended family, for his wife's family, without realizing that he was blowing into their savings. So then she would have to take care of the savings as well. So a lot of things eventually the wife started picking up, because the husband could not keep track of prioritizing, right? And because he was constantly procrastinating, and because of his poor social skills, he would constantly say the wrong thing or point out something inadvertently with his colleagues, get into trouble, and because of that, his colleagues started treating him poorly, so he would feel unwelcomed in the office, and he was frequently changing jobs, which affected his promotion, which affected the you need to have a continuity of job, maintain it at a certain level for you to have promotions and to hike up your pay. That was not happening because he was constantly changing jobs, and he had to reset his career several times, which was really affecting the family. In addition, any little issue that he had, arguments with the wife, he had a tendency to take out with his children, because because of his impulsivity, he could not contain his anger, and he would burst out at the child's smallest of misdemeanors. Maybe the child by mistake dropped the water bottle and some water spilt on the carpet, and that would become a huge issue, and he would end up punishing the child, sometimes maybe even physically. That would further cause a lot of problems. So you can see how uh, the ADHD, which was not managed earlier on, leading to a lot of financial burden for the family, interpersonal issues, and both the children were, to a point where they did not want to spend time with their father at all, and they preferred to tell their mother all their problems, and then the father was feeling very isolated and upset, right? So when ADHD is not managed appropriately or not addressed, it has a tendency to spill over and affect or impact a wide range of personal domains as well. So, how do we manage ADHD? What are some of the things? The first thing, of course, it's not the first thing, but a major part is medication. ADHD can come in different severities. You have mild, moderate, and severe. And we often find there's also a borderline range where it's just about starting to become, to reach a stage where we would need to intervene, but it's significant enough to disrupt the daily activities of the individual, right? So, depending on the severity, the medication and the drug interventions also differ. Um, with the borderline and the mild, maybe we can manage with the behavioral interventions or cognitive training. But the moment it goes into moderate and severe, and especially when, let's say, the child is in ninth grade or between ninth and 12th grade, we do find that it's useful to recommend that they go to a psychiatrist and start medication. Medication can be of two different kinds, depending on what the symptoms are. Is it predominantly inattention? Is it predominantly impulsivity? Depending on that, there can be different classes of drugs. The medication that is given. These medications, you must remember, most often they either short reacting ones or long reacting ones. The short ones have a very time specific, like maybe 5 hours, 6 hours of effect. So they contain the symptoms for the period of time for which the drug is active in the bloodstream. The short acting ones maybe for 5, 6 hours, long acting ones maybe for 24 hours, right? So, depending on what the doctor has prescribed for that period of time, the child is amenable for other inputs. The child is sitting in a place, can sustain his or her attention, and then, the child is ready to receive inputs from you. The moment the effect of the medication wears off from the bloodstream, the symptoms come back, which means it's only symptomatic relief, not a cure. And therefore, the individual has to take it for long term. When there's excessive amounts of aggression, also they prescribe other classes of drugs which can be given to contain the aggression. The aggression, although can become very physical, often stems from impulse control or poor impulse control, and therefore there is a need for medication to contain the aggressive behaviors. Having said that, if we detect it early enough, if it's mild or borderline, behavioral interventions and cognitive interventions definitely go a long way in helping ADHD. Um, what are some of the behavioral managements that can be done? One, definitely in terms of differential reinforcements. What do I mean by differential reinforcements? That, say, for example, the child is being aggressive, or is swearing, or is using foul language, or is crying and shouting. Such behaviors are met with a negative reinforcement pattern, which means that I'm not talking of punishment, I'm not talking about physical punishment, but I'm saying maybe the child has a timeout, or maybe the child is expected to sit in a corner until the anger is controlled, or maybe the child is asked to stay away from the games period, even though he loves being out on the field, till he or she is under control, and then you come back and join your class, right? So differential reinforcement means that for a behavior that's positive, for a behavior that follows the rules, you give them points, you reinforce it positively. And for something that indicates break of rules, something that indicates it's a behavior that's not desirable, then the reinforcement is withdrawn. They can be ignored, or they cannot be given reinforcements, or they can be given negative reinforcements. So that's what we mean by differential reinforcement. Said this, so your star charts are a classical example of a differential reinforcement technique. There have been some parents who've come up to me and said, "Oh, isn't that like blackmail? You tell the child, you don't listen to me, I'm going to give you a black star." How is it different from blackmail? Well, it's very, very different from blackmail. Firstly, because you don't threaten the child with consequences. You have a discussion with the child, and the consequences are decided both by you and the child. That if I happen to break this rule, then this is what will follow. Right? So it's not blackmail, but what you're actually doing is, in a very healthy, in a calm manner, you are insisting that the child is aware of the rules. And if there are consequences for following the rules, and there are consequences for breaking the rules. Obviously, consequences for following the rules are positive and more pleasant, and consequences for breaking rules or disobeying rules are unpleasant and negative, right? So that is set up with the child, and the child has a say in how and when it should be done. And you also have a way of saying, can give you a warning, but beyond that, if you still don't listen to me, this will be in place, and I may not be able to stop it. So if you don't want it, you and I need to talk about what you can do to control yourself, right? And that's how the democratic way of setting it up, where instead of getting angry and dishing out a punishment, which is what a punishment is, that I'm angry, therefore I'm doing this to you. But instead, if you talk of it as a reinforcement, that we've already spoken about it, this I'm doing to help you remember next time when you break a rule, this is going to be the consequence, and helping the child to see that every behavior of ours will have a consequence. If we don't like the consequence, then can we learn to change our behavior, right? So, the example of Vikram that we spoke of earlier, instead of throwing the bottle in the washroom and trying to flush it down, what else can you do? That's one conversation that we are having. But because you tried to flush the bottle down the washroom, what can you do as a consequence to help you remember that that should not be something that you do next time that you get angry? Is the conversation that we have through the democratic parenting process. What does scaffolding mean? Is that often you will realize that children with ADHD know exactly what is expected of them. They know how to behave. But unfortunately, they have trouble remembering it when it's happening, right? So the scaffolding means, just like, you have these pillars or poles that hold on to the pillars for as long as a building in construction requires it. You have your protective mechanisms in place for as long as the child wants it. But remember, the moment the child is able to stand by himself or herself, the protection has to be removed, which means you're not over involved. You don't go and talk to the teacher. You allow the child to go and own up to his or her mistake and talk to the teacher. But you can have a conversation with the child about why, there was a problem with his behavior, and then what can you do to change this? Never what I'm going to do to help you through the situation, but what can you do is the kind of support that the child really needs. And that's how we build support, insight into the child, right? That I'm facing this with my friends because I did this. Therefore, if I can change this, maybe my friends will treat me differently. And then Also, constantly when we're doing this differential reinforcement and scaffolding and building insight, we are focusing on the negative aspects. Can we also focus on what are your strengths and how can you use your strengths to build on and get, to have different consequences of your behavior? uh, Helps quite significantly. Classroom management. Here, most often the teachers do a few things very well, which is describing the rules. You have beautiful charts that are put up in the class. You remind the children of the rules at the start of every year, maybe start of every class or every term. Different people have different ways of doing it. But what we fail to understand is that for a child with ADHD, the problem is not in remembering per se, but in remembering in the moment. Therefore, maybe having a differential seating arrangement, having the child sit right in front of you so that you can prompt the child when the time comes. Remember, class, you're all supposed to be doing your work independently. My back is going to be turned. And what do we do if somebody is getting up from their seat, right? So, that kind of a prompting and expecting this child to answer who's sitting right in front of you, where you can, right in front of the classroom, where you can see the child. And then, prompting, differential seating arrangements, maybe allowing the child to sit next to a buddy who will then help and remind the child. So setting up a scaffolding, a support system, all of this helps. Prompting, reminding, right? The prompts and reminders, yes, they're up on the walls, but for this child, the prompting and reminding may have to be done in real time when it's happening. Remember, when somebody is very angry, very aggressive, real time prompting becomes difficult at that point, and at that point, no conversation can happen and therefore should not happen. But the prompting can be happening as a preemptive step. I expect this child would forget these rules and break these rules. Therefore, before he or she has broken the rules, let me try and remind them, right? So be sensitive to the needs of this child and to preemptively take that step. One of the things that I often find we don't do very well is while we are happy to educate the child and the parents, we fail to educate the rest of the class about the needs of this child. They are also, just like how a sibling of a child with ADHD has to go through quite a bit to accommodate for this child, so too are the peer groups going through a lot in trying to accommodate this child. So maybe sensitizing the peer group about what this child needs, how they can behave when he's aggressive or when he's throwing a tantrum, how not to exclude him, how to also reinforce and provide some kind of a scaffolding and may be a little bit more understanding and inclusive, will go a long way in keeping the child accepted and having friends more often than not, rather than being isolated. Another thing that I find is, especially with adolescents and with adults, time management is a huge cause for concern. So, being good with scheduling, different, like the Pomodoro technique, is really a brilliant technique where you set a target. Maybe if it's a 1 hour study schedule, then I study for 25 minutes. My alarm goes off at the end of 25 minutes, and then I take a break. That break is sitting at my desk, closing my eyes, or just listening to some music with my eyes closed. After 5 minutes, my alarm goes off again. I turn off the alarm, and for the next 25 minutes, I'm studying, and the next alarm goes off at the end of 25 minutes. This time, I have a 10-minute break, and in that 10 minutes, I walk around. I go down, talk to my mother, drink water, and then come back to my room because my second alarm goes off, and I study for another 25 minutes, right? So the Pomodoro technique allows you to choose. Maybe for you, it's 25 minutes and a 5-minute break. For somebody else, it might be a 30-minute and a 10-minute break. Somebody else, it might be 15-minute and 3-minute break. Depending on what your schedule is, what your style is, you can have these breaks. Prioritize, manage your time well, take breaks, reduce your work into smaller chunks that you can manage. And most often, I find with ADHD, all their scheduling is up here. They don't write it down, particularly adolescents. And I constantly keep talking to them about how they can have a written timetable. The written timetable also will be wake up at 5 o'clock, study till 6:30, go for your bath at 6:30, come out of the bath at 7, go to school at 7:30, come back at 3:30, from 3:30 to 5 study, 5 to 6 have coffee, 6 to 9 study. Not happening. Not even 5% of this timetable will happen, because they have no room for personal time. They have no room for play. There is no room for any unwinding at all to happen. So, talking to them about how they can realistically set targets and incorporate maybe a little bit of playtime, and definitely some sports and exercise, and a little bit of maybe screen time, which is included in this break or woven into the timetable, will ensure that they stick to the timetable. Otherwise, this timetable, maybe they will do it for half a day and then they experience burnout and then they never come back. And so, most often, I think there's never been a single child who has told me that I love making timetables and I stick to it. Almost all of them have said, I timetables don't work for me. They won't work if it's this kind of a timetable, and that is the kind of timetable that they have. Building a support system, very, very important, because often the child feels, why am I the one like this? Everybody else seems to be having fun, right? So, one, for the child himself or herself to realize this is not your fault, that there is something that's happening with you, and that's what we are doing. So, building that kind of a we feeling that you're not alone, we are with you. It could happen with the family, it could happen in school, it could happen in the classroom or with friends, or as an adult, it could happen with colleagues or a spouse. On the other hand, the parents and the teachers also dealing with a child like this can go through a lot, and they may be wondering, like, am I doing something wrong that I'm not able to reach out to the child? So being connected to a community helps significantly to understand, share your concerns, to see what works and what does not work, and to take leaves from each of the other's pages. um, I cannot stress enough the importance of physical exercise for people with ADHD. Exercise, on the one hand, brings about good physical health, yes, but for ADHD, that is the best and the fastest way to spend excess energy, and it prevents addiction, it keeps them healthy, it keeps them focused, and they're able to achieve a lot of their goals. As part of a routine, child or adult ADHD, 35 minutes to 40 minutes of exercise every day, and some kind of maybe relaxation, um, like yoga or meditation or swimming or something like that, or music as a hobby once a week, is essential, something that would really help. And also, if they're adults, to stay away from stimulants like alcohol or drugs or cigarettes, and coffee can definitely being converting that, the dopamine rush that they feel when they drink alcohol or they smoke, can be converted or channeled into physical exercise, which will bring about same results but in a more healthy manner. Of course, cognitive intervention goes a long way. We've seen tremendous progress at our center. We do offer improving executive functions in people with attention deficits. There are exercises that can be done to improve attention, to reduce impulsivity, to improve working memory, and to strengthen the central executive network. Meditation helps strengthening the default mode and the crosstalk between the two, the salience mode. Therefore, all of these methods do help. Cognitive training goes a long way. I've sort of run out of time, so I may not be able to focus too much on cognitive training. But if you have attended my previous talks on executive functions, then you would know what I'm talking about. It goes a long, long way in. So, what the medication does as a short term, cognitive training does as a permanent change. The brain is a very plastic organ, and it responds very well to training. So you can build, you remember I was talking about the dorsal attention system and the ventral attention system and the crosstalk. These are bundles of nerves. And when these neurons are not connected properly, or they are weakly connected, is when they don't fire properly. But through cognitive exercises, these cells can be connected, and cells that fire together wire together, and that builds neuroplasticity in the system. And that's how we are able to reduce impulsivity, improve attention, and improve the executive functions. And that brings about a huge change, right? So, just to wrap up, implementing, first of all, identifying that the individual has issues. Identifying and diagnosing ADHD is very, very important. The earlier we identify it, the better it is. That then leads to and facilitates better management techniques. And the management should look at not just the symptoms of ADHD, but also the social, emotional, behavioral aspects, along with the cognitive aspects, which overall will then have an impact on their academic performance as well. Yeah, I'll stop here. Thank you so much for your patient listening, and I'm open for questions now.
You can unmute and ask, or you can type it in the chat box.